Alrighty, guys. Thanks for rocking up to the dock on a Wednesday after running for resilience. We've got the honour tonight of having a mental health forum. It's going to be hosted by Thomas Emerson. Come up here, Thomas, give the spiel, and thanks everyone for coming.
Cheers, Shooter. Thanks everyone for being here, and thanks to the doc for having us, to the Running for Resilience crew for using their platform to help promote the event, and for everything you're doing. I just think this is such a cracker thing that you're doing all the time, and Wednesday nights, I wish I could be here more often. It's a good run out there tonight. My name's Thomas Emerson. I'm an independent member of our local parliament, the Legislative Assembly, so not the big one up on the hill. There are 25 of us, and I represent the electorate of Currajong. So if you don't know, that's central Canberra, the inner north, and also here. So if you live in Kingston or in that area, I'm one of your representatives. If you don't, you're dead to me. Vote for another independent next time if you want better representation. Great to be here. I think we'll just rip straight into it. So we're starting off with special personal reflection on mental health from one of the regular runners here, Lili Mooney.
Hi everyone. It's a real honour to be here today to talk about mental health and the power of community. Firstly, I would like to thank Tom for organising this event and inviting me to speak to you all about mental health. It's a massive honour and an even bigger mystery as to why I was asked. My interest in local politics extends as far as which party promises the most parkruns, and I'm certainly no expert on mental health. Accepting this, however, I believe is very powerful. I do not see mental health as something with an endgame or a cure. Instead, I see it as a journey. My journey with mental health has been closely tied to something that's been part of my life since I was a child: running. I started running with my dad when I was young, purely as something I liked to do with him. You could say that I did it because my other 3 siblings didn't, and it meant that I got all the attention, but we won't comment on that. Back then, it was not about training hard, pace, or distance. It was about connection, joy, and being present in the moment with Dad. That love for running followed me into high school, where I started training more and quickly became that kid at school that took cross-country way too seriously. I began to see running as something I had to excel in and prove myself in. I pushed myself harder, setting higher expectations, and without even realising it, I lost the joy that running used to bring me. At the same time, I was also battling an eating disorder, and when I was 15, I was diagnosed with anorexia and had to stop all exercise. My final memories of running as a teenager were not good ones. Looking back, I don't blame running for my anorexia, but it certainly didn't help, as my relationship with exercise was very unhealthy. It became something that fed into my illness rather than helping me heal. Instead of using it to stay healthy and something I enjoyed, I was using it to control my guilt around food, and eventually had to start exercising in secret to avoid getting in trouble. At one point, my parents threw away my brand new pair of Nikes. I'm sure this was the best thing for me at the time, and they did it with the right intentions. But the fact that I now own at least 20 different pairs of runners probably suggests I'm still a little scarred by it. When I was finally weight restored and out of hospital and treatment, I honestly didn't think I'd ever run again. The memories were too painful. Running had become tangled up with my illness, and I couldn't imagine it being part of a healthy lifestyle. However, years later, in my final year of university, I found myself drawn back to running, not to compete, but to cope. Uni was stressful, life was overwhelming, and I needed an outlet. One day I was going for a walk, as I usually did, and I don't know why, but I just started running. I wouldn't have gone for long, but the way that I felt immediately after was incredible. They talk about a runner's high, and I truly felt it that day. I started running again a couple of times a week purely for the way it helped my mind. Later that same year, I saw a fun run coming up for Lifeline, a cause that's really close to my heart, so I signed up with Mum and we ran it together. I'll never forget the feeling I had crossing that finish line. It wasn't just about completing the 5K, it was about being part of a greater cause. It was about community and connection, just like it had been with Dad all those years ago. I always tell people, even if you don't particularly like running, sign up for a fun run because the vibes and energy as you cross the finish line are unmatched, and it's a great way to accidentally get addicted to running. From that Lifeline fun run, I discovered Parkrun, and not long after, I met Ben, who introduced me to Running for Resilience, and I started going every week. And what I found wasn't just a running group, it was a community, a place where people show up for each other and support each other. I always say my favourite thing about R4R is that on a bad day, it gives me an opportunity to get out of my own head and forget about whatever problem I've been thinking about. I always leave in a much better mood than when I arrive. Now, I run for many reasons. It helps me manage stress, it gives me structure, but most importantly, when I'm out there with my friends, chatting, laughing, and maybe grabbing a coffee or a drink afterwards, it's not about control, it's about connection. And while this may sound like I've conquered my mental health, I am mindful of how easily I could fall back into those negative habits. At times, I still struggle to convince myself that energy gels for long runs are necessary, or that I am allowed to have a treat on a weekend even if I haven't done my religious Sunday long run. I, like everybody else, have mental vulnerabilities that will always be with me on my mental health journey. Community-led initiatives like Running for Resilience are powerful because they're inclusive, supportive, and grounded in shared experiences. They remind us that healing doesn't always have to happen in a clinic. Sometimes it happens on a park, on a trail, or over a post-run coffee. You also don't have to enjoy running to get the benefits of communities like R4R. Any sort of movement is good for our minds. Walking, yoga, playing pickleball, it doesn't matter. The key here is movement with mates. Thank you for letting me share my story. I hope it's a reminder that we don't have to run alone, literally or metaphorically. There is strength in community, and together we can keep moving forward.
Amazing. Thanks very much, Lili. Another round of applause for Lili. Come on. Just a taster for the podcast episode. If you haven't listened to it yet, you need to. Running for Resilience podcast, produced by Lonsdale Street Studio. Thanks to Damo for doing that, and also for streaming us here tonight. I listened to it. It's an amazing story. And you said, oh, you know, kind of, why have I been asked? I just think there's nothing more powerful than hearing from someone in your community about their own lived experience of something that you might be going through too. So nothing better. Well spoken. We're going to go straight into a discussion, and I'll kind of lead with a few questions for the panelists, but then as soon as we can, we'll open up to the floor. And if you guys have nothing to say, then I've got some other questions in my back pocket, but hopefully there's input and questions from the floor. Before we do that, we'll just introduce who's here. We've got Ben Gathercole, CEO of Menslink. Carrie-Ann Leeson, CEO of Lifeline Canberra. And I'm always forgetting Benny Alexander on the end here, Running for Resilience. So the first one's a pretty open one. We'll see how we go with it. But, you know, for me, I think what we're seeing with this mental health crisis, I mean, what could be more important for us to talk about? Something's going on, right? The rates of mental poor health we're seeing aren't normal, and in a clinical setting, if we're just counting on getting more psychologists through the door over and over and over again, and that's what we're going to do to solve it, I don't know if that's going to be enough. There's something going on at the root of it. So I just wanted to hopefully have some general reflections, and anyone jump in on what you think is at the root of this mental health crisis. You know, what's really going on here, and what if any, are the groups that seem to be disproportionately impacted?
Sure,
Cheers, Ben.
I'll jump in. Well, thanks once again. It's really great to be here, Lili. Thank you for sharing your story. But I think Lili might have hit on some real key points there. It's really about connection. So from Menslink's point of view, we educate young fellas here in the Canberra region, so between 10 and sort of 20. One of the things that we're actually noticing in today's society is disconnection. Disconnection from school, disconnection from family, disconnection from sporting groups. I mean, all of us sitting up here, you know, really had that genesis of sporting groups, family, church, other social groups to actually fall back on and be involved in society. And a lot of young people nowadays actually don't have that. So the disconnection in society, and it's very easy to be sort of locked in your bedroom, so to speak, or the young, from our perspective, young guys lock themselves in the bedroom, and that's where the online and the internet and all the echo chamber type things start to happen there. So from our perspective, it's really about trying to continue to create connection. So with what Ben is doing with the connection with Running for Resilience, what Lili was talking about, is really important from our point of view.
Carrie-Ann.
Yeah, good points. I'm audible, thank you. In terms of what Ben was saying, connection is incredibly important. I think timing is also one thing that I think is whether services are available or whether they're available at the time at which people want that help and are willing and able to do the work. At Lifeline, what we tend to focus on is not the crises. I think I've used that word once in my 11 years in this role because it can leave you feeling rather helpless and hopeless. And I think one thing that we find is incredibly powerful is around bringing hope and strength and courage and vulnerability through connection, but also timing, making sure that there is someone willing to have that conversation with you when you're ready to have it. It's a tough conversation to have, and following that conversation, it's about deciding what your steps are going to be. It's so complex that it's almost impossible to solve as a systems problem. At Lifeline, what we do see, the same 5 reasons that people will call Lifeline, they haven't changed in over a decade, are relationship breakdowns, alcohol abuse or substance misuse, domestic violence, mental illness, and isolation. Now, financial distress will dip in and out of those, but one thing I can say, and shout out to the crisis supporters that are here tonight, and they'll agree with me, we've never taken one call that's the same as the other. So how does a mental health system cater to each and every one of us who are so unique, who never have the same crisis at the same time or the same needs within that crisis at that time? So I think the solution actually rests in the community. But in terms of what we're seeing, I think that's an important conversation to have, because it's not potentially the health system that is a problem we can solve. It's a truth to be accepted. And it's really about empowering communities and starting with ourselves.
Well said. You got anything to add on that, Benny? No worries. Well, I might come back to you then, Ben. You touch on education. The young, in your case, the young boys, young men that you're working with. What's kind of the gap? What are the unmet needs that you're seeing that maybe your mentoring programs and also your education work in the schools try to address?
So the simple answer to this, it's also always about resource. So we could, if we had more resources, we would be able to do more. But the truth is that we are well supported by the ACT government, and in particular well supported by the ACT community. So we're very thankful for that. What we know is that if we work on creating better young men, they're going to be better middle-aged men, and they're going to be better older fellas as they go through their journey and their life, so to speak. So we really hold that close to our chest, trying to create better young fellas, and then surround those young fellas with some good, obviously, peer-led learnings as we go along, but also the mentors as they go through life, and then the role models later in life. So it's quite a big deal for us to have, quite obviously I'm an older fella. It's quite important for us to have role models through our organisation that young guys might not necessarily know that they're modelling, but we're always there for them. And it's important just to be there for our young fellas. We don't have to have the answer every time, but just to be following and be part of that journey is really important to us. So that's one of our big things. A lot of people talk to me and ask me why we're a gender-biased service, so just for young fellas. What we know, we have this big ripple effect that goes on. So if we've got a better young fella and he's going home and he's being a little bit better in terms of in the house, in the home environment, to his family, so his mums, his sisters, his nan, his aunties, inevitably that means he's probably going to school and he's being better to his school teachers. And it just generates a little bit of momentum. So we know that we make a big difference not only to our young fellas, but that ripple effect sort of resonates out in the rest of the community.
Cheers, Ben. Yeah, and for those who don't know, Fearless Women, great organisation that's popped up to mirror what Menslink's up to for young girls, and they've also been funded through the ACT budget, so they're very happy about that. I might throw it to you on that, Ben, and you kind of touched on it, Carrie-Ann, the importance of opening up, like having someone there on the other side when someone does seek help. What do you see as the role of community and obviously things like Running for Resilience in creating a space where conversation's possible?
Yeah, like what's that, Damo? Sorry, that better? Yeah, so what was the question again?
The importance of community and opening space for conversation.
Yeah, so when I retired from sport, I was like super aware of like the role of like sleep, nutrition, exercise, how good that was for my mental health. And so I retired thinking, I just focus on that, I'll be good. Because I'd lost a teammate to suicide, and he had a wife, kids, he'd studied at Oxford, Sydney University, so that was a real wake-up call for me while I was still playing, because I wasn't feeling great even though when I was playing, and I thought, geez, you're not feeling good, Ben, and you're still playing. You know, what happens, retirement's pretty tough. I'd read any article about athletes struggling in retirement, and so did a lot of research about trying to help me understand what I was feeling, and learned about sleep, nutrition, exercise, and thought I was ready to retire. But a few years after retiring, despite eating really well, sleeping, exercising, I still got depressed and was still in a really bad way. And the thing that I learned most from that, and the bit that I really think I was missing, was just how important social connection is for our nervous systems. Like, I think the word mental health these days, it means different thing to different people, and I think a big reason why people still struggle is we don't have as a community, we haven't actually decided or agreed on what is actual mental health. Is it the brain? Is it the body? I think it's nervous system health. That's sort of what I believe, and I think that's a big part of what education around mental health should be, is around understanding the nervous system and what it needs, and that nutrition and exercise, sleep and exercise are a big part of it. But the studies are all out now. If you're being lonely is just as bad as smoking a pack of cigarettes a day. So you might as well be darting up with your mates. You're just as healthy than if you're on your own and lonely. And I experienced that being through when I retired, doing my own business, working from home, and not feeling great. And I remember I needed to come and roster myself down here at the pub to come hang out with Shooter and hang out with staff and just be around people. And I didn't realise at the time why that was, but then just learning more about the importance of community and the role that social interaction, we are social creatures. We have evolved in communities, in villages, and our nervous system and our neurochemicals. There is like a scientific explanation behind it. I won't try and do it, but the communities play a massive role in making us feel at home, feel welcome, and that's, I guess, something R4R is always trying to do. I'm really proud of Lili sharing her story. Breenie and I have always tried to share our struggles, to normalise. We're all going to go through rough patches in life. It is super normal, and the more we can just talk about it, not in a pity party way, but just in a, I'm doing a bit shit at the moment, I'm struggling. That's when people around you can actually help. But if you just bottle it up, you don't ask for help, you don't have help-seeking behaviour, that's when you can your nervous system will just get more and more burnt out. And I think that's the biggest part R4R can play, is not getting people running, but getting people to feel okay that, it's not that bad to put my hand up because I can get help and I can get through what I'm facing.
Is this something you see at Lifeline? Yeah, well said. At Lifeline, Carrie-Ann, when people do reach out, is that often something that's been a barrier for people, a sense of shame, not wanting to seek help? Do you get feedback that people have thought about reaching out and they finally have? What's that dynamic like?
Yeah, absolutely. I think, Lili stepped out a moment ago. I wanted to acknowledge you, but you were out of the room. Thank you so much for sharing your story. I think lived experience and actually basing a health system around lived experience is something that we need to take on board. And that was very brave. We're up here talking and we feel very uncomfortable. We're not bearing our soul. So very, very powerful message. Thank you. Thank you.
Kudos.
In terms of vulnerability and in terms of strength, I always talk about the courage it takes to pick up the phone. People talk about what courage it takes to be on the crisis supporter end, but it takes immense courage to pick up the phone and ask for help. That's one element, of course. What drives the help-seeking behaviour or the barrier to that can be stigma. Stigma by your community, so that's the importance in terms of community addressing stigma, but also self-stigma. So what we sit with internally and the stories that we tell ourselves and the self-talk that we use in terms of understanding our own value. During COVID, we were talking a lot about self-care and reaching out, self-care. And I was talking to my team one day, being essential services, we were all in, masks on, 3 meters apart, and one of my team members pulled her mask down and just said, what on God's earth does self-care look like to you right now? And I thought to myself, wow, it's actually not useful or helpful telling people that they need to look after themselves and reach out for help. And because until they see the value in themselves and they see themselves as someone worth saving and someone worth doing the work for, they're not going to necessarily have the self-awareness that meets that self-compassion and reaches out for help. So we started running self-compassion workshops. And I think one of the things people in community and in these events and in these engagement and activities can do is show you value in yourself that you don't see. So it's self-compassion, which leads to self-awareness, the courage to pick up the phone or reach out or mention to a buddy that you're struggling. I think that's where it starts. Stigma is obviously a major issue that we spend a lot of our time trying to address.
And just on that, how much do you see a barrier in people feeling like, well, someone else is definitely doing it worse than me, so I'm not the one who needs help? Is that something that comes up?
Absolutely. Hear it all the time. People often will say when they do get the phone answered, they'll be, I don't know if I'm bad enough to call. I don't know if my situation, our ability to place others in that position of needing help. The media have a bit to answer for there in terms of what we see being relatively normal in terms of crisis or disaster, being near that end of life. Lifeline's done a lot of work to try and position ourselves further upstream in terms of crisis. We're not necessarily there just to assist in the event that someone is having suicidal ideation. That's been a lot of work because a lot of people will always see someone as being worse off than themselves. And the important thing to realise is that working on things sooner and getting the help you need sooner, finding your GP and your psych, your coach, your mentor while you're happy and healthy is a much better way to go rather than waiting until you're unwell, you're fatigued, you're tired, and what you're trying isn't working. So it's important to try and get to yourself earlier. Yep.
Yeah, just to back that point up, we certainly see that in young guys, the stigma about reaching out for counselling. So we've actually gone around a little bit differently. So we go out to schools and we talk about help-seeking behaviour in our Silence is Deadly workshop, and that's particularly around suicide prevention. We now actually hand out a sheet of paper with a QR code, so quite anonymous. It just goes out to every young fellow that comes along. They can put it in their pocket and take it away. And obviously you scan the QR code and it runs through the Menslink services that you need and so forth. So it's just taking away some of the layers of, I need to go home and tell mum or dad, or I need to go to footy and tell this guy. So we've tried to take away those barriers because even in young people, there's a real stigma about calling and talking about breaking up with my girlfriend, or a bit of online porn, or there's some online gambling going on, or my mates don't talk to me anymore for some other reason. They don't recognise those as behaviours that they probably need to have a chat about. So we're trying to take that stigma away, exactly what Carrie's saying.
I do want to ask on that, Ben, you and I were speaking the other day about your kind of peer-to-peer facilitated work that you're doing, and it comes back to what Benny, I shouldn't have two Bens on a panel, was, could have made another choice. It's what Betty A was saying about that connection, not always necessarily with a mental health practitioner, but with your community. So could you talk us through what you're doing in that space, and maybe on the back of that, if there's ideas that come up in terms of how we could do more of that sort of stuff. And then I'm going to throw to the audience, so you better have questions prepared. I haven't planted any, which is a mistake as well. So if people on my team, you better have questions prepared.
So one of the things I was talking to Tom about the other week was we're starting to develop, we're becoming much more matured with the way that we educate young fellas for us, but young people in general. We all in this room can recognise the fact if you say, no, don't do that, me as an elder says, do this, do this, do this, it doesn't resonate that well. So we've now started to develop our workshops in a facilitated but peer-to-peer type experience. So we lead the workshop, and the young fellas start to talk about what they what we're leading, what they're trying to create for themselves, about whether it's feeling better about themselves or how they treat other people in their family or how they treat society and how they go about just becoming better young men. And as I said, we've figured out that just telling somebody to do it doesn't work really well. So if we can do that in that, I guess, yarning circle style environment, and we facilitate it, but it's the young people coming up with the answers. It obviously works a lot better when you talk it out aloud like this. It's like, oh, that's a no-brainer. But for years, teaching's always been, righto, Tom, this is what we're going to do. Doesn't go down that well.
And you've got them doing kind of daily check-ins and shifting culture within the different schools.
Yeah, so one of our signature programs, which is called the Tribe program, which goes all term, what we've actually happened to the school counsellors and the teachers have come back and said they've actually noticed the young guys going out at recess or lunch or even before school and running their own check-in circle, and they're just checking in with the other fellas and they're bringing other young fellas of the school community into it, and that's exactly the way that you want it to work out.
So I might throw to you on that, Ben A. How can we do create more of those opportunities across the population? Running for resilience might be part of the answer, but yeah, keen to hear if you've got any further reflections.
I think just as a community, the one thing I think a lot about what R4R I think we're doing really well is just creating an environment where people feel like they can be themselves, that they don't have to come and put a mask on. I know at work, a lot of people put on masks and they act like they got everything together, and that's really bloody draining. Like, to act like you've got everything together when... Yeah, so just trying to, as we're saying, everything we've been saying, just trying to create an environment where if you're not doing all that well, that's fine, that's normal. We're here to help. But on the flip side, the reason why we are going to be able to help as a community is because we're all looking after ourselves first and foremost. We're putting ourselves first so that we can then help others. So the more, as a community, that people... Yeah, it's kind of counterintuitive that you've got to put yourself first to be able to help others. But just, really enforcing that amongst the board and the volleys, trying to really lead by example of making sure we're great examples of self-compassion and self-care. And that's going to then put us in a position to not be patient's the right word, but to be able to help when someone isn't feeling great and is in a bad way. And we're really grateful for our partnership with the Medicare Mental Health Services Centre. So if someone comes on a Wednesday night, or we get messages from people not in a great way, we're like either Lifeline, or if you need to go and get an appointment, you go to Medicare Mental Health Services Centre and the person gets assessed, and then they'll get introduced to the right professional support. Because I was really lucky that I was very hesitant to go see a psychologist. All the stigma, coming from a big sort of sporting background, I didn't want to go see a psych. But I was very lucky that some family convinced me to go see the Brumbies, and they put me in touch with a great sports psychologist, someone she transitioned out of sport herself, so Carrie-Ann Leeson, and she was incredible. And a huge part of my turnaround has been from the work that I've done with my psych. But I was very lucky that we clicked. She got me from the straight away. She's worked with lots of rugby league clubs. And a lot of people don't have that experience. When they finally do put their hand up, they go see a psych, it just doesn't click for whatever reason. And hopefully we can, as R4R as a community, we can then create the environment where people can admit that they're not feeling great by destigmatising it, and then direct them to the professionals. So get them to go to Medicare Mental Health Services Centre, which will then increase the chances they'll get introduced to the right professional support. I think that's a model that hopefully all sporting communities can do. Bring people together, make them feel welcome, make them feel like they can be themselves, and then if someone in the community does put their hand up, they can quickly get them off to the right services. Whether before they need to call Lifeline, try and catch them before they're in a super, super bad way.
And just a practical one, quick follow-up on that then, Ben. If someone is, like someone here could be, feel like they're ready to seek help, where do they go after running for resilience or before? Do they come and chat with you? What's the way to do it?
Well, yeah, if you really desperately need help, you call Lifeline or you go to the hospital, you see a GP. But, so we haven't done enough to make a song and dance about this, but through Carrie-Ann, my psych introduced us to, the Medicare Mental Health Services Centre. It's a bloody mouthful. They need to sort their name out. But you go there. There's one in Civic. They're building another one in Tuggeranong. They're building 60 across Australia. and it's a triage centre. So like you go to the hospital, you don't, if you busted your leg or whatever, you run you get taken into the emergency department, you get assessed, you get triaged, and then you get put in touch with the right doctor. You don't, if you're having a broken leg, you don't get sent to the cardiologist. So hopefully that's what the Medicare Mental Health Service Centre is, because I know when I was in a bad way, there's no way I could have Googled and found a psychologist. Like if I typed Psych Service Canberra, there would have been a million lists. I would have been overwhelmed, and I would have just gone, it's all too hard. And I would have just kept plugging along. Whereas if you go to that centre, they won't they won't treat you or anything. They just assess you, and then they go, okay, we think this service is the best for you. So you might have struggling the way Lili was struggling. They might put you in touch with an eating disorder expert, or as an athlete transitioning out of retirement, I could have spoken to someone else, or if you've got PTSD, you'll speak with an expert in PTSD. So that's kind of this network sort of structure that we think that hopefully running for resilience we're getting feedback from Medicare saying that people are coming as a result of R4R, which is awesome, and we'll do a lot more. Everyone in the community, all you lot, we got to do heaps more to help raise awareness of that centre, because they're the experts, they're the ones that'll help. We'll just raise awareness and try and shine a light on their amazing work. Same with Menslink and Lifeline as well.
I think it is an important, what Ben is saying, hands up if you've done a first aid course. Yeah, so we can do CPR, we can address snake bites. You're far more likely, who's done mental health first aid? That's fabulous. I don't think I've seen more than 5 hands go up in all my decade. That's incredible, well done. I think in terms of if you're going to do a first aid course, make it a mental health first aid course. There's far higher chance that you're going to come into contact with someone that needs that first aid. We need to normalise mental health injuries, mental health illness, like we do physical, and that's part of the conversation that we're having. And then, as Ben was saying, the help for you might not necessarily be that formal, structured medical system. It might be alternatives. The first time I met Ben G, I'll call you Ben G, Ben A and I were having coffee, and I just had the roughest day. It was a 5 a.m. start, and it was just like, hi, my name's Carrie, blah. This is who I am, this is the day I'm having. And then Ben was like, well, me too. And I think normalising not being okay, normalising having a rough day is where it starts. Just, it's about trying to ensure that people feel safe to have that conversation with you as well.
Great advice. We'll throw to the floor. If anyone's got a question, a statement, feedback, and we'll try to get... do you want to run the mic? The mic is coming.
Okay. Oh, God, I had a mic. Can you hear me? Yep. So, hi, I'm Georgia. I'm a teacher, more recently a mum, and I guess... I can only speak from my own perspective, mostly from the education setting, but I work in a high school, and I think in a world that is so tuned into mental health and diagnosis and seeking help and the ways to go about that, there are some real positives that have come out of that. But what I'm finding still is, and I work in the wellbeing space at school, so I do find that you were speaking about connection before, and I feel like there's still a huge disconnect between students being able to go home and share with their parents about how they feel. I think they use school as a safe space, not use school, but they do feel like school can be a safe space, but then at home, I'm not saying it might not be a safe space, but the capacity and narrative around how they express that is still difficult. And I guess, I don't really know what my question is, but maybe are there programs or initiatives that can bridge that gap? Or, I can set it up myself if it needs to be done, but I would really love to see, I guess, more of that. Particularly in the high school space.
Georgia, I'm probably well placed to answer that. So thank you for your question. Yes, we see that disconnect also. Absolutely. The truth is that a lot of families and a lot of parents are struggling with the same thing that their kids are. So that real, probably a little bit different problems, but it's usually money-orientated, work-orientated, family-orientated. So it's really hard for young people to go home and engage with mum and dad with that. That's not an easy conversation to have. So I totally acknowledge that. Can we do a better? Can we do better with that? Absolutely. How we do better than that, I don't have the 100% answer, but I certainly acknowledge what you're saying and totally agree. Yes.
There is a, well, for one, I think that's probably a challenge to us as a community, you know, and as parents as well, to open those spaces from when our kids are really young. And I think it's great that you're talking about it and thinking about it. There is an organisation called Mental Illness Education, ACT, and I believe they're running programs within schools. But I have to say, I'm not sure if they're focused on speaking with parents or, you know, the peer-to-peer they are. Do you want to answer this, Heidi? Do you have some more to add, or? Would that be right? Because I think it's a question, is that, you know.
So MEACT are lived experience educators, and they do go into schools, but they also go into workplaces and any community groups. So historically, they've been invited to share their lived experience at a parents' evening. And so that's been a really great way for parents to not be told your child may or may not be okay, but to hear about some of the experiences that people have gone through when they have had low mental health or are living with a mental illness, and then that's helped to bridge the gap for then parents to be able to seek further help and support from there. So it's a really great place to start the education journey, and then MEACT also have programs on their website that parents can do to further build their skill.
Thanks, Heidi. And they run programs in workplaces and so on, and you can contact them if you want to have them do that. So we're going to try to get one done in the assembly for the members and staff. Down here.
Sorry, before the question, Lions fans, we're going to get the footy on soon, all right? Don't worry, we're going to on, all right? Go the Reds.
Hey, just a quick question for me. Canberra is a pretty unique place. What do you think are the blind spots of Canberrans or people in the ACT when it comes to mental health?
Who's lived here the longest?
You give a mental health answer, or while you're thinking about a mental health answer, I think one of the unique features of the city is the transitory nature of this place. So we know in the ACT we've got the highest rates of loneliness in the country. 40% of people report experiencing loneliness, which is pretty staggering. And the rates are highest among young adults, which is not what you tend to assume. But, you know, when I'm chatting with people, you know, which you don't often chat with lonely people, to be honest, but when I hear from, you know, I'll chat with international students who are visiting and they've just not managed to create connections here. People who might be doing a grad program find it hard to break into networks. And I think that is a bit of a reputation that Canberra has, is that it's like a, you know, it's a physically cold place, but also a bit of a socially cold place. But what I hear also from people when they do manage to forge those relationships is because it's a tight community and everyone's 15 minutes away from each other, once you kind of bridge that gap, there's actually a lot of friendship right there, and it's easy to create and maintain those connections. So I think it's probably on us a little bit, people who have been here for a long time, to try to look for ways to create more opportunities for people who haven't and are newer to the city to connect into those networks, because otherwise it can remain a bit cliquey, you know.
Yes, and to add to that, I think as well, we are highly educated. So when something seems to be feeling wrong, we try and solve it, and we'll look for stats, we'll look for information and science. It's quite different, again, because we're not connected to necessarily our families, we're all living away from home. You lack that wisdom. So during COVID, there was a lot of information in terms of numbers hitting us every single day. And I kept trying to seek out the wisdom. I tried to find the people that, you know, that this too will pass, that really philosophical way of, because your frame of mind and how you look at something, and what Lifeline does is just sort of elevate individuals above their scenario and give them a bird's eye view, enable coping. So when you're feeling like you're not coping and you're looking for more and more numbers to fuel that and evidence that feeling, it's very hard to break out of it. So again, connection can help with that. I think in terms of blind spots, you know, I would say that yes, there are areas that do need addressing. We've obviously got, we could talk about the budget. I could talk about the budget all night. Let's talk about the fact that they're charging $11 for volunteers to have to work with vulnerable people. So there's a lot of, I guess, input into the system that we're in. But I will say that the ACT government, the National Capital Authority, are all ears when it comes to identifying and discussing those blind spots. An example of that is in Canberra. 10 years ago when I started in the role, I sat with the NCA and the ACT government. We have a suicide hotspot in Canberra. And the conversation 10 years ago was, we don't want to hear it. We're not putting up signs. We're not going to ruin the beauty of our city. We're not dealing with that. It's just a problem that you have to solve on your own. 10 years later, the NCA have put up the signage. That spot has been identified as a suicide hotspot. There is a number to call when individuals reach that spot. We've had 2 calls from that spot and no incidences since, and that's only been live for 3 months. 2 live, so thank you. I think it's a testament to absolutely having the blind spots, but I think Canberrans are all about jumping on it.
Another one from the floor over here. Thanks, Hannah.
Hi, I have a really quick question. So one of the ethos that we have at Running for Resilience is this idea of a funnel of crisis. So at the very bottom of the funnel, obviously those are the people who are in acute distress, who need hospitalisation or the support of organisations like Lifeline and Menslink. Then one level up from that, we have those who, with the right psychological support, whether that be from a friend or a professional, will be able to navigate themselves through that situation. And then at the very top of the funnel is where we see ourselves operating, which is providing an opportunity for people to be able to connect and move on a regular basis. And if we can keep people doing that, then the likelihood of them falling through the funnel is significantly decreased. I think my question is, obviously at the bottom of the funnel, there's a lot of clarity around investment to result. But as you move up the funnel, it becomes more and more ambiguous because you don't know how many people's trajectory you've changed through that level of intervention. So I guess my question is, how do we have the courage and the bravery to invest in the ambiguity the higher we go up the funnel to ensure that we can reduce, I guess, the crisis point further down the funnel? And how do we work, I guess, between the bands?
Yeah. I get to get political. Hey. Well, you mentioned the budget, so we had the ACT budget a week ago. And that was kind of, that was my main reflection, and the main reflection in the team is the budget contains over the next 4 years another $1.196 billion in health funding. So that's predominantly hospital funding. So it's acute. And of course, you break your leg, you want somewhere to go. But it's the ambulance at the end of, literally, right, at the bottom of the cliff. Or another example is there's $16 million in the budget for homelessness services to work with people who are experiencing homelessness and provide that kind of support, whether it's material aid, food relief. But only 102 social housing dwellings in the budget when we've got more than 3,000 approved applicants on our public housing waiting list. Then you only get on that waiting list if we know you can't afford the private market. So we're doing there's this pressure, and it's a political pressure a lot of the time, to invest at the acute end, because you do want to have a doctor there when you show up at the hospital, and it's very measurable. What are the wait times? How many people have been waiting longer than they should have? How many people are seeking help from homelessness services and aren't able to get it? And so on. But that stuff upstream, which is hard to measure, which we know saves us downstream, and it's been studied and reported on over and over and over again, doesn't get the investment. So at the same time, those kinds of figures, $1.196 billion for the health system, there was just a $10 million uplift in community sector funding. And they're the organisations that really do the preventative work, like what Menslink does, like what Fearless Women do to address things downstream. So I guess what I'm saying is it is a problem, and I do think that there's a big role for politicians to change their thinking and show a bit of courage in how they think about investment and think about prevention. You can't really measure all the lives you've not, the issues that didn't arise, but there are places around the world where they've started doing this. So Victoria, for instance, has an early intervention investment framework, which is really focused on shifting decision making. In the ACT, we have a wellbeing framework, which is supposed to shift decision making, so you're focusing more on well-being, not just on the kind of economic, pie. We love the example of Wales, so I'll use these examples, I always do. Wales got self-government a little bit 10 years after we did. And 10 years ago, they introduced the Wellbeing of Future Generations Act for Wales. They basically got together as a country and said, what do we want for our country? And then held themselves to account in actually making decisions that aligned with that conversation. So one example is they shifted all their transport infrastructure investment from things like roads to things like footpaths and bike lanes. Because they said, we want to be well. We want to be spending more time outdoors, moving actively rather than stuck in cars. But that takes courage. And they got slapped on the wrist by a lot of people for doing that, people who wanted to see more road duplications. But I think it comes down to what are you hearing from constituents? Because we're politicians when we don't have the courage. There's self-preservation involved. And so if everyone in the community is saying the same thing, saying let's invest more upstream, then at some point people listen because they want to keep their jobs and get back in next time. So I think we could talk a lot more about it as a community.
Mate, it's like we can't wait for the wheels of government to start funding in that thing. Mate, you got to take action. Everyone here has got to start working at that preventative layer, doing whatever you can do out in the community. It's something I'm super proud of. I know Shooter is too, that the doc plays its part. I mean, I only learned recently that the word pub is short. It was the original, it's from public house. Back in the 1800s, a pub was known, obviously, pubs aren't all great, but hospitality venues are a really proud part of the 2 Before 10 group, the Jetty, another pub, Frankie's at Ford, creating these environments where we can start working preventative. It is the community that's going to do it. Hopefully the government and the wheels and all the politics will eventually start dedicating funding there, but we cannot wait. We've got to get going with what we have and just do the best with what we got. And I'm super proud with the rate. You've seen the suicide rates in Canberra, that we're now well below the national average. Incredible drop, and that's we've contributed, but it is the work of everyone in the Canberra community, Lifeline, the government, Menslink. Everyone in Canberra needs to work towards a goal of eradicating not just suicide, but then all ill mental health. And because I truly believe Canberra is the most beautiful city in the world, and we should have the healthy and happiest people that reflect the environment that we live in. So we've got to get going. We can't wait. All right, Timbo?
Well, on the back of that big rev up speech, how can people who are here and want to get involved and they're feeling a little bit of fire thanks to you, Benny A., how can they get involved, whether it's through your organisations or otherwise? I think it's a good opportunity to spruik. Everyone's always looking for volunteers and donors. Let's just run down the line.
Thanks, Tom. So for us, we're always seeking mentors to help our young fellas. So on our website or the QR code, just jump on the website, just runs through what's required of a volunteer that comes and helps us out. So that's really pretty simple for us.
Thank you, and a very worthwhile role as well, having met and heard from people that have been through the program. From Lifeline's perspective, we have so many volunteering opportunities, whether it's a one-off, fundraising at a Raiders game, or whether you want to go through the warehouse, sort books, work at a warehouse, book fair over the course of a weekend, or even undertake the crisis supporter workplace training and be on that end of the phone when someone does find that courage to ask for help. lifelinecanberra.org.au, all of the volunteering opportunities are there. We would love to have you. Evelyn. Oh, we have a crisis supporter, Evelyn, who's willing to tell you about her experience here tonight. Thank you.
In the orange scarf, Evelyn.
And then good work. Just come to Running for Resilience. Come to one of our events. Head to runningforresilience.com to find out about one of our 15 weekly events across Canberra. And if you bring a friend, or if you know someone struggling, maybe send them the link to Medicare Mental Health Service Centre, and maybe just give them a nudge and say, hey, maybe give this a try.
Well, I think, I love the mission, right? Make Canberra suicide free by 2033, I should say. Already failed. By 2033, why not, right? And if it's a place where we can, I'm sure there's people who have come here for the rugby and they just stumbled into a mental health forum. They're going, what's going on? Especially if we got visitors from overseas. What's going on in Australia? What's going on in the capital here? But I think it's pretty special that we can run an event like this and have people turn up and really care about it. And that's an incredible sign of the work that you guys have done, the work your organisations are doing, and also of how much Canberrans care. So seeking help and making it clear that you're there to help, I think, is something we can all do, and obviously we all are doing. And I just think it's incredible that we got people here to have these kinds of conversations in a public house. So I think that's probably enough from us. I want to thank everyone for being here. Thank you everyone for taking the time. To all of our panelists, another round of applause.
And Lili.
Thank you, Damo and Lonsdale Studio, for recording and live streaming tonight.
And you, Tom.
Yeah, to
Thank
Damo,
you.
to Lili for her sharing as well. Bravo.
Shooter.
And
go the Reds.
Shooter and everyone for putting it on. Thanks for being here. Have a great night.
Footy. Let's get the footy on.